we very carefully, like choose this topic on sustainability and environment. It is really a very important concern to all of us, especially people from higher educational institutions, and obviously for the people who are doing research in this particular domain. So, coming to the next of my slide. So I would like to praise that the UN Sustainable Goals. I think you all have heard about UN Sustainable Development Goal, and they have given very important 17 sustainable goals that most of the countries are really working hard to achieve these by 2030. But I think it is not been possible to for all of us to achieve it. And in that, it is very specifically a talk about this goal of three. If you see goal number three, that is on good health and well-being. So all these goals are important. So my talk is focused on good health and well-being, taking support of the other goals, because once we talk about the environmental and sustainability, we have to keep in mind the other aspects like clean water, sanitation. We can say like life beyond the water, energy consumption. That is another very important. That is kind of this. Collaboration, climate action. So, goal number three, like climate action. So, all these goals support us, and they are interning to each other to achieve, all these goals together. So, coming to the point, like what is the healthcare management? So, we have already know that we are the higher educational institutions, and we are also running some programs which under the domain of healthcare. So in healthcare, like it involves the organization, coordination, and oversight of healthcare services, which we can ensure the effective delivery of healthcare to the patients. So it encompasses a wide range of activities, which including the management of our sites where we are working, like whether it is maybe hospital or clinics or other facilities, healthcare facilities, and their planning and administration of these healthcare services. So these two are the very important aspect of healthcare management. Coming to the next part, that why this healthcare management is important, and in my coming presentation, I will connect this healthcare management with the environmental sustainability and green technology. By adopting all these things, how we can make our healthcare more sustainable, more eco-friendly, more you can say environmental friendly. So it is very crucial for delivering this high quality patient care, and we have to be optimizing the resources which are available for these healthcare facilities. We also would like to improve the patient outcomes by managing these healthcare through the sustainability, and we also ensuring the sustainability of this healthcare system, because once there is always involvement of the cost. So we also take care of that. This healthcare system should be sustainable, but sustainable in the terms of eco-friendly or environmental friendly. And it's also directly impact the patient satisfaction, operational efficiency, and the financial performance. So these are some important aspects that why we need these healthcare management, or why these healthcare managements are important. So current challenges in healthcare management, what the current challenges we are facing in this healthcare management. So if you see that we are facing these more major four challenges in our healthcare management. The first and most important is this rising cost. As you know that these costs are continuously increasing. In healthcare, the costs are continuously increasing. Factors like if we have to incorporate the advanced medical facilities or advanced medical technologies. Then now with the aging of the population, because curing of the aging population is again one of the challenge, which also increases the cost of healthcare system, and also the growing prevalences of the chronic disease, because to manage the chronic disease required lots of cost, or you can say lots of resources in place at the same time. And these all lead to the financial strains on the either on the healthcare system or on the patient. So this is very important. One of the important, you can say, the challenges, current challenges in the healthcare management system. Next to this is the resource constraints. So constraints means like the facility we have often shortage for these essential resources, which usually included the proper trained medical staff who are trained and who can provide the sufficient, you can say, the care to the patients, then equipments, and you can say the medications. Sometimes we don't have all those equipment in place. So resources constraints are always a challenges for any healthcare system to make it, more sustainable. And also, they may lead to the more longer wait time period for the patients, and they also reduces the access to the care, and may lead to the lower quality of, you can say, the services. So, if we have proper resources in place, we can manage healthcare system very well. But because of the resource constraint, we are not able to manage these healthcare systems properly, and this has remained one of the important current challenges for healthcare system. Next is the regulatory compliances and issues. Okay, so healthcare management may also, navigate the complex regulatory compliances and the environmental issues. There are various laws, there are various standards that time to time, consuming the cost, and they are coming in forces, and the healthcare system has to adopt these regulations, laws, or environmental, you can say, standards to make their system sustainable. But it is very, very difficult to comply all these challenges, to adopt all these regulations, to follow all these norms, and it remain become a challenge for this healthcare system. And now, another important is the technological integrations. So it is not only for the healthcare management; it is mostly like we as an educational institution also facing these challenges like, the new technologies are coming day by day. For example, if we are talking about this specifically to the healthcare system, like electronic data management or electronic health records, this is important aspect right now, but they require the integration of lots of new technologies and the support system, IT support system, to you can say, like adopt these things and to make the people aware, or to make the staff aware about these systems and processes. So there are another issue with this, like the data security. If someone is recording your, health data, or they require to record your data, so they have to be give that declaration that they will not, make it publicly available, or they will not share with others, because this is something confidential. So how we are managing all these with the limited resources and retaining resources, and again a challenge for the healthcare system or healthcare management system. So what's the sustainability in healthcare? So in the few slides, I have talked about what is healthcare management system, what are the current challenges for this healthcare system. But now coming to the part of the sustainability and what means in the sustainability in the healthcare. So sustainability in the healthcare refers to the implementations of the practices that meet the needs of the present without compromising the ability of future generation to meet their own needs. Okay, so I'll talk about in detail what all these are practices, how we are going to implementation these practices in healthcare system or healthcare management, make them more sustainable. And this also involves the balancing environmental, economic, and social considerations. So it's cover all these three aspects. That is environmental aspects, that we have to create the system processes like that which is environmental friendly. It complies the all environmental regulations, laws, and it is in sync with the environmental conditions. Also, considering the economic and social consideration, that is important So this is what the healthcare, this is what the sustainability in the healthcare system. Now, what is the aim for these sustainability in healthcare management? So the aim in the sustainability to this healthcare management is to reduce the environmental impact. Obviously, whenever there are certain units or hospital or healthcare facility, they have to their own emissions, discharges. So we have to reduce it, reduce their impact on the environment. And another important aim is to lower the operational cost. So if we adopt the sustainability practices, or if we aware about the sustainability practice, we can manage it well with a lower operational cost, and we can parallelly improve the social outcomes. So by adopting these sustainable strategies, any healthcare facilities can enhance their efficiency, ensure long-term viability, and contribute positively to the public health and the environment. So I will also correlate all these practices with our higher educational institution practices, like we as a Chitkara University, how we are adopting these practices in our university, and now we are one of the, you can say, among the top universities in India who are, you can say, adopting these sustainable practices, and who are like, we are the zero discharge university. Whatever we take, in which form we are taking from the environment, the same we are, giving to the environmental back. So we are zero discharge campus. So like whenever the points come, I will also correlate. So as a higher educational institution, we can also adopt these sustainable practices in our own organization in a very, you can say, stepwise manner, or we can suggest these things to our, you can say, senior colleagues, to our student, to our other stakeholders. And if you are directly in the hierarchy, you can talk to the management. You can also suggest these things to your management, so that you also adopt these things in your day-to-day life, and you can make your own institution as a sustainable, or you can say as a green institution, or eco-friendly institution. Another important aspect is that, in Himachal there is also a survey, like the and you know that AICTE, All India Council for Technical Education, also conducted a survey for Swachhta ranking. The universities who are clean, environmental friendly, and the processes they adopted. So our university also get that ranked among those under top three university in the country, because we adopt these practices in our university in day-to-day life. So the four important pillars for the sustainability in healthcare, or I can say in our, because my topic is given, the topic is given me to related to the healthcare, but I can say this is implicable, or it can be implemented in all type of facilities, or higher educational institutions as well. So the most important pillar, the four most important sustainability in healthcare, or you can say in any other thing, is energy management. Obviously, we have to be very very cautious about the energy management, and we are also, you can say, uh, aware about what practices we are adopting to make our organization or our facility, that we are energy, you can say, saving, or we are following the energy conservation processes in our organization and in our facility. There are also process like energy auditing is there, and our university also do that energy auditing process, where we at the last take a call how we can, save energy in our organization, because we usually have a big facilities. We have lots of classrooms, laboratories, administrative areas, and other areas. So every time there is a need of light, or you can say fan, but we are very careful about this energy conservation and energy management. Now another important aspect is the waste management. So recycling of the waste is very very important. Segregation of the waste is very important, so it can reduce the hazard, and it can have a positive impact on the environment. So I will also let you know how we are doing this in our university, like waste management. So we are no plastic. In our university we don't use plastic at all. We also talk these things to our stakeholders, like our students or our, you can say, employees. So you don't find any plastic bottles. We usually use the glass bottles or reusable bottles. Okay, so single use of plastic is also banned in our university. Most of the cases we have seen that the project, the project or for the assignments, there are files. So we don't allow all these things in our university. Even in our tuck shops, these things are not available. So we discourage it. So we send simple paper, or you can say the student can staple it and make a tape, and they can submit it. So if you see, there are 100 students and they are submitting three type of assignment. How much plastic they are using, and you can see you can say the management is again a challenge. Usually we send back to the you can say to the other authorities or for the management, and they may not take care of about these things. So this is again a important aspect. Now the air quality and management. So lots of systems are in place where we can control the quality of the air. That is basically HVAC system is there, humidity, ventilation, and air conditioning processes. So it has been centralized place. So it also make it effective and also reduce the cost. And we can make our, you can say, the organization sustainable. Now, the water management is again very, very important aspect. So reduce water, or you can say the water metering process, water metering system, or we can say water recycling, or we can say like water treatment. Okay, so that we can recycle it. So in our university we have a STP plant where we recycle the water. So I have already told that we are the zero discharge university. We don't send anything to the environment back. We treat everything in a house and reuse it, make it reusable for our own uses. So what we do in our university, like we treat this water, and we use that water for the plumbing in the hostel, or for the gardening purpose, because these water are good in the nitrogenous content. So it's also help for growing of the plant, or so you find more greenery. Our university have more than 70% green area, because we use that, you can say, treated plant, which may help. So we don't require any fertilizer or the treatment or any organic pesticides, which again lead to the burden on the environment. So we reuse it, we make it reusable for the purpose. So in our all hostel, we have the double plumbing system, where this treated water is used for the plumbing of flash, and this other there is other system which you student use for bathing, or for, you can say, for toothbrush, or for their washing, for their, you can say, bathing. And we don't allow any student to wash their clothes. So we have a mechanized laundry in our university, where because student you don't they don't have the control on the surfactants, so they can use a high quantity of surfactant, and again, the removal of these surfactant from the cloth again challenge, and they can use more amount of water, or they can use like for making these surfactant release from the water, they can use more water. So what we can what we are doing, like we have a mechanized laundry in our university. So they usually, you can say, their clothes wash there, so we can control this way also. So why there is a need of sustainability in healthcare? So there are different, you can say, constraints, like environmental impact on healthcare. So environmental impact on healthcare means like, hmm, carbon footprint of healthcare facilities, and waste generation and disposal issues, economic benefits like cost saving from sustainable practices that I have already told you, that this way we are saving the cost of the pesticides or this organic pesticides. So we can, save the cost, energy. We can save lots of cost in the energy, and they may lead to the long-term financial stability in the organization. There are again the social responsibilities or social benefit that means lead to the health impacts on the communities, and there are ethical considerations. So this carbon footprint, now there is a you can say the concept of green buildings, and this green buildings, you can say that having that system in place, that we are our building itself, consume less electricity, and with that less electricity, we can avail all those facilities that is required. So this also reduces the carbon footprint part, and this may lead to the sustainability in the organization. So carbon footprint, we also have to reduce the greenhouse gases emissions, and the healthcare facilities or institutions, they can if they are consuming larger amount of energy for heating or cooling or lighting, so their operating cost can be reduces. So this reliance of the energy may often drive from the you can say the fossil fuels they usually use for heating cooling system, which lead to the increased carbon emission. So if we say there is an example of in US, in US alone is responsible for using 10% of the country electricity in their healthcare system. Sorry, 10% of the carbon emission through this healthcare system. So if they make it more sustainable, they can reduce this carbon emission. So now coming to the next part, like waste management, or usually in healthcare we term as a biomedical waste production, or this biomedical waste management. So what it is if you all know that usually in any healthcare system or any healthcare management system, we have the different type of waste, pharmaceutical waste. We have hazardous materials. We have the plastic, medical, you can say medical waste also. है ना? So all these disposable may lead to the environmental contamination, and they may lead to the risk to the public health as well. So, इनके examples like single use item है, जैसे कि syringes हैं आपके, gloves हैं आपके, packaging material है, which may again lead to the you can say the growing problem of waste management. This is again a very important consideration to all the government, how they can control this biomedical waste, and what strategies they are using is again a constraint for them. And we cannot reduce, we cannot make it, you can say, reduce it up to that level, which may not harm to the environment. So this is again very important consideration, and the safe and sustainable management of these waste is crucial to minimize the environmental harm. Now, coming to the cost saving from these sustainable practices that I have already told. So there are many ways by which we can, making the we can save the cost, and we can make our organization sustainable. So implementing these sustainable practices may lead to the cost saving for these facilities. And like what are those? You can say the practices like energy saving or energy efficient technologies is there. Then we have waste reduction program, water conservation management system, or water conservation measures. We can use it, or we can also use the recycling of the water as one of the important process in the organization, which may lead to the you can say lower down the operational cost of the organization. So and now how we can do it? For example, for in case of the an energy, if we can use the energy efficient lighting system, and nowadays there is LEDs come, so they are quite energy efficient, and also like HVAC system, centralized humidity ventilation and air conditioning system are in process, so they can reduce the energy bills, and they can also lead to the organization in a sustainable way. So they may lead to the long-term financial sustainability. So these sustainable practices contribute to the long-term financial stability of any healthcare system or any healthcare organization. So by investing in the energy efficient infrastructure and sustainable resources, healthcare facility can be mitigated these risks which is associated with either the fluctuating energy prices, because now the energy prices are increasing, and it also depend upon the units we are consuming it. Price, I don't know in other state, but in Punjab, like energy up to 300 unit it is free. So government is also promoting that you consume less energy. Once you use more than 300 unit, now you get the your energy bill. And if it is more, so the cost per unit also increases. So energy also motivating the people, like they use energy in a very you can say conservative manner, or they use that approach to save energy, and they can also save their economic sustainability, and they can also make it long term sustain. So there is also the social responsibility, or so this impact the communities. That sustainable health model is there, and this healthcare practices may have the positive health impacts on the surrounding communities, and they lead to the reductions in the emission and waste minimizing. You can say the air quality and water quality also improving. If we minimize this waste, the quality of air and water also increasing, which also improve the public health outcome. No, so it's a kind of a cycle. So if we make a less waste, so that less waste lead to the less air and water pollution, and that water pollution, air and water pollution may lead to less public, you can say, health issues. Okay, so public outcome is also improving by the sustainable measures, and this is what the model I'm showing where this denied like this. It's a collective efforts, and this is nothing. It's simply adoption of the sustainable practices, which increases the socioeconomic benefit and also lead to the sustainable health for all the communities we are living in the society. So ethical considerations. So this ethical considerations like healthcare organizations. So they have a moral obligations to operate in a manner that does not harm the environment. Okay, or public health. So adopting sustainable practices align with the ethical commitment. So we have to be very, very, you can say, the careful about that. We do not harm, and demonstrate that it is a social responsibility towards the society, or you can say towards the environment. So by reducing their environmental footprint, any organization or any healthcare facility, they show the leaderships in addressing these global challenges, such as climate change. Like I've already discussed in my first presentation, that climate change is one of the important UN Sustainable Development Goal that we are working hard. And the global warming may lead to lots of consequences, and lots of you can say new things are coming because of this global one. So These all are setting an example which the other sector needs to follow. So this is very important that we have to be take care of this ethical consideration. Now coming to the sustainable practices in healthcare. So I have already talked about what is the healthcare management, why sustainability. Now I am going to integrate these two things, healthcare management and sustainability. So how we are implementing these sustainable practices in healthcare management. So, so first one is the energy efficiency. I have already talked that energy efficiency, we have to be take care of the renewable energy resources like solar and wind, and these healthcare facilities can significantly reduce their carbon footprint by investing in these renewable resources, energy resources, such as solar panel. They can install the solar panel. In our university, we also have solar panels, which also reduce the energy cost, and in long term, it make us sustainable. And also like wind turbines which generate the energy. So these renewable resources provide sustainable and cost effective alternatives to these traditional fossil fuels or this traditional energy generation methods. So the example is like mm, this energy efficient uh, like sorry, I am talking about the example. So example is the some hospitals, they have the rooftop with the solar panels, and having the winds and wind turbines, which may lead to the generation of the power for the healthcare facility. So energy efficient building. I have already talked about this energy efficient building design, and this is now nowadays it's a trend nowadays that most of the buildings they are energy efficient buildings, and they are the green buildings. So adopting the energy efficient design and operational practice, they can greatly enhance the sustainability in the healthcare facilities. So this includes like building insulations, utilizing natural lighting. Okay, we make the plan like this: every room or every facility have the natural lighting, or HVAC system, smart HVAC. Nowadays, a smart HVAC. HVAC means like humidity, ventilation, air conditioning. So smart HVAC system it's a AI based basically. So it recognize feel the energy of the person. Of if the number of person is less, it reduce the lightning, or it reduce the you can say supply of fan or supply of air conditioning. It depends कि like area में कितने person sit हैं, or accordingly automated. So it's a smart HVAC system or the facility which do not have any manpower, or which do not require any air or air conditioning. Uh, there you can say the signals is automatically off. So these smart HVAC systems are now in place, which make the energy efficient buildings or green buildings. So, like examples like we have incorporating now the LED lights in our facilities, smart thermostats, and building automation system to optimize the energy use, which is based on the real time data. So now we are using the technology for making this energy as a renewable form or as a energy efficient building designs. Now coming to the waste management. So recycling and waste segregation, this is again very important consideration. So in the waste management, like just coming, this is an example of solar power plant which has been installed in many hospitals in the Tamil Nadu and in Karnataka, and they may lead to up to 70% of energy expenditures. Okay, so this is an example where the healthcare facility they are making them sustainable by reducing the energy consumption, and also reducing the carbon. So this is what about the green hospital. I have already talked about this green hospital, and in green hospital, like this is what we have in place. Like we have to reduce the CO2 generation, and the construction is like this. We have all lighting system, natural lighting system, the smart HVAC system, and this is what the uh, biomedical waste system we have. So this recycling of waste segregation. So recycling of this waste segregations, they require the you can say the proper guidelines, and this reduces the volume of the waste we are sending for the landfills to minimize the environmental contamination. So you see that we have a different type of biomedical waste in our healthcare facility on our healthcare institutions. So we can segregate it accordingly, and we can send so that we can reduce this biomedical waste. You can say the consumption processes.
Hello, good afternoon, sir.
Anju, good afternoon.
Sir, I have one question.
Yes, please.
Sir, how we can motivate our healthcare professionals to implement sustainable practices, because people don't implement, or they do, so they do for short periods, for short period or short duration. So,
Mhm.
sir, can you please suggest for this?
Yeah. So your good name?
Sir, I'm Dr. Shashi.
Okay, so Shashi, can we take the questions at the last? First, I complete my presentation, then we'll go for the questions. I think that would be the best thing.
Okay, 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 sir.
But it's a really good question, and I will answer it. First, I will complete my presentation, and then I'll take these questions.
Okay, 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 sir. Thank you, sir.
Thank you so much. Thank you, Shashi. So again, this reducing the single-use plastic is again one of the important consideration. So you know that in most of the healthcare facility, we use lots of single-use plastics that I have already showed in you my previous slides, that we use syringes, cannulas, all these things. So we have to find some innovative alternative methods of these disposable items, and promoting the use of reusable material. So this is again a challenge for all of us, and again an option. Challenge, I can say it is an opportunity for all of us as well as a higher educational institution. We can think about these, and we can find some alternative methods. So I can tell you one example, that if we can replace these disposable plastics utensil and cups with reusable one in the hospital cafeteria, so it may use the using this biodegradable or this compostable material item. So they can reduce the burden of these waste. So this is by this way we can also make it more, you can say, uh, sustainable, our healthcare system more sustainable. So water conservation, we all know that we use this water conservation system. So in water conservation, this includes the using low flow fixtures, and these healthcare facility can adopt water saving technologies and practices which reduce water consumption. So they can use like low flow fixtures. We can use the recycling water where possible, and we can also implementing the water management plan system in our healthcare facility. The example is like installing low flow facets toilet and shower heads. Okay, so if it is a low flow shower heads, it reduces the uses of water, and we can save lots of water in that way. We can also implement the water recycling system. I think nowadays most of the hospital or higher educational institutions, they have this water recycling system, and they can use this gray water for non-potable purpose such as landscaping and cooling. As that I have already told that in our university we are adopting this system. We are the zero discharge university, and whatever the water we are using it, we have a STEP, and in that it has been recycled, and we use this water for our gardening purpose or in our double purpose system, or we can use it for irrigation purpose. So this is one thing that we can make it our organization more sustainable. Now coming to the like kind of the technologies for this wastewater treatment or uses in the hospitals. So like kind of the advanced water saving technologies can help the healthcare facilities to manage the water more effectively, and these technologies can identify like the leaks, the optimized water uses, and ensure the sustainable water management. So, for example, like water meters are there to track the analyze the water consumption in real time. So, where there is a less use of water, we can stop or shut down that particular unit. So, real time we can monitor it, and we can also implementing the irrigation system or the sensors where we can reuse it all these facilities for this our landscaping and reducing unnecessary water wastage. So, in healthcare facilities also we are using some other treatments or other method where we can also save the waters. Like for if we would like to disinfectant our pharmaceutical active ingredient, we can use the ozone treatment processes, or we can use the membrane bioreactor that again lead to the less consumption of water. And for example, like in cases of the mm, antibiotic, we can use the chlorination or UV treatment. So there are certain methods and strategies which we can use in the healthcare facilities to for the wastewater treatment and for their reuse. So now, what are the various keys for the effective use of these systems in the healthcare? So I have already talked about that the strategic infrastructure investment, which may lead to the long-term operational management, and they embodies like energy, eco-friendly systems, clean design principles we can adopt, and may lead to the reduce in the carbon footprint or operational carbon productions in the healthcare facility. I have already talked about this electrified transport paradigm. So nowadays, this lead to the zero emission. In our university also, we have lots of electric vehicle, and we usually discourage the because the students have to move from one place to other place. Some visitors come on our university on the regular basis. So we use the electric vehicle to reduce the zero emission. So likewise, in the healthcare facilities, they are using it, and they can make it more sustainable and eco-friendly. So, and as renewable energy system that I have already discussed, and I have already talked about that, like kind of solar system panels, and we have to find all these systems where we can reduce the uses of the fossil fuels, which may lead to increase the carbon footprint and making the environment more uh, sustainability practices again is an important consideration. So this is most effective factor that, like I have already talked about, there in our university we have lots of sustainability practices, and we are nourishing it or we are encouraging it. Like we are zero plastic a university. We don't encourage our students so to use plastic folders for their assignments, to wrap their assignments or project. Simple paper is sufficient. We recycle the papers also, and we have recycling paper unit. So, in this way, what we are doing, we are nurturing the sustainability practices, or we are nurturing the sustainability, you can say, encouraging the sustainability practices, which lead to, again, you can say, boost the environmental considerations. Pharmaceuticals and emissions is also one of the important consideration, and we also have found out some alternative methods for their, you can say, transparent reporting purposes. Circular waste management is also there. Like I have already talked that in circular waste, like if we you can say produce less waste, they may lead to less air and water pollution. That may lead to again less public health issues. So I think you have already studied that in the recent report, most of the disease, most of the non-communicable disease or healthcare disease, anyhow, the pollution is one of the important consideration or trigger. I have already mm, uh, discussed that in in recent report, it has been published that diabetes is because of the air pollution. So it is again, this is a circular waste management, and if we control it, we can reduce the burden on the public related to the health. Now, digital empowerment and sustainability, that I have already discussed with all of you, that we have to be more technologically invest, so that there are lots of technologies are there. We can integrate these technologies in our, you can say, system, in our process, that also help us to make us sustainable and eco-friendly. So this is one example where the Turkey can using this renewable energy in their this example is specifically for their healthcare system, and their health cost is reducing because they are reducing the energy, and they are promoting the renewable energy processes, and that's why the health system, their healthcare system cost is has been reduced. Now, the policy and regulations framework. So, this is again very important consideration that there are certain policies and regulatory framework. For that, we have international standard and guidelines, like WHO guidelines on sustainable healthcare, ISO standard for environmental management 14001 and 50001, and the Indian Green Building Council. Okay, so coming to this particular aspect, I would like to talk about this WHO guideline in sustainability and healthcare. So the World Health Organization has provided the guidelines and recommendations to promote this sustainability in healthcare, and these guidelines cover area like waste management, energy efficiency, and water conservation. So examples like World Health Organization guidelines for healthcare waste management, they included the strategies for the safe disposal of hazardous material and minimizing the waste generation, so that it can impact less to the environment and we can make our environment more sustainable. And they have given the recommendations for improving the energy efficiencies in healthcare facilities to reduce the greenhouse gas emission. So that's where WHO have already been issued certain guidelines, and most of the healthcare, you can say this is facilities, they are adhering to these guidelines and following these guidelines. Now coming to this ISO standards for environmental management. So what ISO, given the regulations and framework that develop standards like ISO 14001 specifically, and ISO 50001. So they provide the framework for environmental management system, and they stands help the healthcare facilities implemented effective sustainability practices. So ISO is also promoting, encouraging the healthcare facilities or healthcare institutions, where we are providing the education related to the healthcare to follow these guidelines, and making our, you can say, system and process more sustainable. And ISO 14001 certification for the hospitals, and it's usually implementing the comprehensive environmental management system, which usually ensuring the continuous improvement in sustainability efforts. So this adoption of ISO 50001 for energy management, and they are the guiding facility in efficient energy use and reduction of the carbon footprint. So there are other some national and you can say the local government initiative and funding also. So what is all these things? Like many government offer initiative. So they offer the initiative to funding opportunities to support sustainable practices. So what the support or funding they are giving us, like they reduces the percentage of loan, interest loan, if you are following these guidelines, or you got the low interest loan. And they also give you some grants to implementing these you can say like you have heard about the subsidy on the solar panel, government are promoting even on houses also nowadays. If you are there are certain government, I'm not sure about the but in Haryana, I think that is a policy. If you are using the solar panel in your house, or rainwater harvesting system, government is helping you, and they're also providing you certain subsidy. So this is what the government is also having some initiatives, and they are providing the funding and incentives under some national policy programs for implementing these sustainability and eco-friendly system and processes. So regulatory requirement for these sustainabilities in healthcare facilities usually complies with the regulations that ensure the healthcare provider to contribute to the environmental conservation, and obviously it also impact the public health in a very positive manner. If we take care of our environment, we can also in other way, directly or indirectly, we are also take care of the public health, or we can say we are also providing the public better public health. So these are some guidelines and framework which is already been issued. So I have already told that there is a concept of green building certification program, where it is LEED LWD, that is leadership in energy and environmental design, and there is BREEAM, that is building research establishment environmental assessment method. So LEED certification is there, where the hospital that meet the stringent criteria for energy and water efficiency, indoor environmental quality, and sustainable sites development, they get certified through LEED certification. And there is a BREEAM certification, where the healthcare facility, they are being recognized for their low environmental impact and high performance in certain sustainability matrices. So this is again leads to the higher level, you can say, the recognitions by the national and international agencies that the organizations are following the sustainable practices. Now, coming to the next part, that is the various challenges and barrier for implementing these sustainable practices and these eco-friendly practices in healthcare system. So that I have already talked and discussed about this. Financial constraint is one of the important consideration, that this is one of the challenges and barrier, because adopting all these system and process involve the very high cost. If we are using any renewable energy system, so there are certain capital cost involved. So it's the first like initial cost, but obviously for any new organization, a new healthcare facility, it's a big amount. And if they are installing the centralized AC systems, or HVAC, that is humidity ventilation, air conditioning system, with all these sensors, and you can say the modern smart system in place, they cost effective in the long term, but they require some initial outlays or initial capital cost. Now, there is a funding and budget limitations. So many healthcare facility, they operate under very tight budget constraints, and make it very difficult to allocate the funds for their sustainability projects or these sustainability. So they have very limited access to the funding and financial options, and they can lead to the adoption of sustainable practices. So example is like many of the hospitals or healthcare facilities, they are struggling to secure the grants or loans for their sustainability projects. and their budget allocation prioritization for immediate healthcare need over long-term sustainability investment is very low. So they have more priorities, like they are going to be upgraded their healthcare facilities in terms of patient care, rather than they have some sustainability system and processes. Now coming to these technological limitations, so availability of sustainable technologies, they can be very limited, especially in the region where less developed infrastructure, and where there is a kind of less awareness about these green practices or green concept, green technologies, like difficulty in sourcing energy efficient medical equipment or advanced waste treatment technologies in certain areas, and lack of supplies for sustainable materials and technologies. Now, this integration with existing system. So, this new technologies with existing healthcare infrastructure may be challenging because there are like kind of compatibility issues, and there is a need of extensive modifications that may lead to this adoption of these processes. Now, there are also some cultural and behavior barriers. So, I think now, Shashi, you will find the answer of your question, that resistance to change among the staff. We have not been, you can say, brought up like this. We have to be take care of our environment and sustainability. So it is very, very difficult to change the attitude, to change the behavior of the staff in their routine practices, especially if they are not adequately informed and trained, or they are not aware about the benefits of these sustainability initiatives. So this resistance can slow down for adoption to the new practices again, and this lack of awareness and training. So the lack of awareness of education about the importance of the benefit of the sustainability can be significant barrier, and without proper training the staff may not be fully understand how to implement these sustainable practices effectively. For example, like insufficient training program on sustainability for healthcare professional, lack of informational resources about sustainable practices and their impact on healthcare operations. Okay, so again, the waste management require lots of training, practices, and skills. So if the healthcare professional are not trained, they are not able to adopt all these practices in their routine, and it is become a challenge and a barrier for implementing in the healthcare institution. Now, what are the various strategies for implementing, how we can implement these practices in the healthcare facility or any of the higher educational institution system? So the most important is the stakeholder engagement, so involving the staff, patients, and community. So successful sustainability initiative require the active involvement of all the stakeholders, which includes healthcare staff, patients, surrounding community, and engaging these group ensure that everyone is aware and committed to the sustainability. That is again very important consideration. And for example, like organizing the workshops and seminars to educate them more sustainable practices and their benefits, and the conducting community outreach program to inform patient and the public about the facilities sustainability efforts and how they can contribute in the sustainability. So now building a culture of sustainability, like I have already told that in our university we have a culture, we have a system and process in place. And from the very initial, we are like in every department, we have all these sustainable development goals, so that our all stakeholders get aware about what are these sustainable development goals. We, very prominent places display lots of information about the environmental considerations, like no use of plastic. We have having lots of dustbin with their colored marks, so that they can easily recognize it, and we can easily segregate our waste, so that we can dispose it accordingly and make the waste management easy and efficient. So it's a culture that we have to be built in. Likewise, papers we have a like student know like they have to be fixed. So we have a paper recycling units in our university. So on weekly basis they collect it and they go back. So each and every you can say stakeholder in our university, they know about the importance of the sustainability, environmental consideration, and they work accordingly. Now, education and training, I have already told that programs and for the healthcare professionals. So comprehensive education and training for healthcare professionals. So they ensure that the knowledge and skills we are implementing and they are maintaining more into the sustainable practices, offering continuous education program. So what I recommend nowadays, uh, most of the people, you are from the higher educational institution system, you must involve some value addition courses in your so there is one environment that is already been UGC mandate course, but you must involve the various sustainability, you can say the programs or SDGs goal, and how we are going to address these SDG goals with their day-to-day practice, because it's a collective efforts. So UNA, DIA have mandate. So who are going to implement it? Organizations are going to implement it. Universities are going to implement it. Society is going to implement it. Then only we are able to achieve these goals by 2030. So there is a continuous education program or continuing education program on the topic like energy efficient. Like if you see in our every switchboard, we use that safe energy, so that when we go back, we should switch off our lights and fans or unnecessary energy consuming gadget. So this is important that we have to display all these informations prominently, and we make aware about our students, our faculties, and our staff about on these topics and their management. And then again this sustainable procurement, and again this partnering, how we can be in a partner or we can collaborate those organizations which provide all these specialized training on this sustainability and on this environments. So all this what we are having here, and now we have some continuous improvement programs like monitoring and evaluation of sustainability practices. So we have to be regularly monitored and evaluate our sustainable initiative that is essential for identifying areas like improving and ensuring the goals we are being met. And we also look what the data we have collected, how we are going to analyze those performance and making some necessary adjustment, so can we can make achieve our sustainability goals. Now adopting new technologies and regulations, so staying informed about advancement in sustainable technologies and change in the regulatory requirement, which is crucial for continuous improvement. So adopting of these changes usually ensure that the facility remain compliant and benefit from the latest innovations. And there are certain examples, right? Regularly reviewing and updating sustainability policies, which help the organizations to meet the standards, and the investing in the new technology that enhance the sustainability, such as advanced waste treatment system, next generation energy efficient equipment. Nowadays, you know that there are sensors available, and in our university, in some of the places, we also install that sensor, especially in the toilets, where lots of energy consumption is there. So what we did, we installed some sensors, and when the movement is there, the lights and fans adjust when on, and automatically it become switched off. So this is what we are integrating these sustainable practices in our higher educational institution system. Now, coming to the future trends in sustainable healthcare. So, there are emerging green technologies. So healthcare sector is seen as a emergence of innovative green technologies and like kind of renewable energy, sustainable material and waste management system. So next generation solar power nowadays is they are very higher efficiency, you can say, rates, and they have a good energy storage solutions like advanced batteries and biodegradable medical supplies are there. So these are all emerging green technologies that are going to be implemented in the healthcare facilities or higher educational systems. Then there are potential impact on healthcare management system like these technologies can revolutionize the healthcare management by reducing the cost, improving the efficiency, and minimizing the environmental impact. Now, there's a time to the global collaboration. So, sharing best practices and resources, international collaborations now allow these healthcare facilities to share these best practices, resources, and technologies for this sustainability. This can accelerate the adoption of effective, sustainable initiative globally. So, examples are like international conferences and symposiums. They are going in the various places. Where the experts share their insights and successful case studies, how they are implementing these sustainable practices in their facilities. Now, there are lots of online platforms, network for this healthcare professional to exchange ideas and solution. Now, there is also international partnership. So, international organizations, international government, and non-profit organizations can also provide this additional support for resources for this sustainable projects. So, like WHO, UNDP also implemented the large scale sustainability programs and the partnership with the global technology companies to deploy like uh, advanced sustainable solutions in the healthcare settings. There is also holistic approach to the health, and in this we are integrating the sustainability into public health policies. A holistic approach where the health and these health policies are become integrated into the policies and like encourage the reduction of air pollution, water pollution, and the promotion of active transportation like walking, cycling. And these are the creation of green spaces. Nowadays, if we, you can say, purchase some battery vehicle, government is also promoting it. Government also installed certain cycles, bicycles on the roadside. We have just to promote them. So it make us healthy also and may lead to less air pollution and other pollutions in the environment. So this is what the green space or green practices they are using it. So it's also been integrated into the public health. Now focus on the preventive care and wellness. So they can reduce the burden on healthcare system and promoting the sustainable healthcare outcomes. So these approaches focus on maintaining healthy and preventing disease rather than just treating them. So we always talk that prevention is always better than the cure. So, like community programs are there which promote healthy lifestyle, such as nutrition, education, exercise, and some smoking cessation programs. So, preventive screening and also, helping in the early interventions strategies to reduce the need of the extensive medical treatment. So, this is again very important that by reducing this, we can improve the healthcare management and we can make it more sustainable. So, last but not the least, I conclude my presentation with with this important and very useful quotation by Dave Haaland, and he wrote that we must shift our thinking away from short-term gain towards long-term investment and sustainability, and always have the next generation in mind with every decision we make. So we should take care what we are going to give to our coming generation, what our ancestors give to us, what our you can say uh, father or our grandfather gives to us, and what we are going to give to our next generation. And we also take care of the long-term investment in this sustainability rather than the short-term gain. So, with this, I would like to thanks to all of you for giving me this opportunity and for listening my presentation.